Back. Hi, it's Dr. Eric Balcavage, and we're back for another edition of the Peripheral Neuropathy and Diabetes Learning Series. And today is episode 5. We're talking about the 6 mechanisms of peripheral neuropathy. And as I said I think in episode 2, there's 6 primary mechanisms. It doesn't matter what type of neuropathy you have. If you have peripheral neuropathy, these are the 6 mechanisms that cause damage to your nerves. So this is the third reason, or the third mechanism, and that is organelle damage. So the little parts of your nerve cells can actually become damaged. And what happens is this hyperglycemic state in the neuron, because you have high blood sugar, increases something called mitogenesis, which means it makes more mitochondria. The problem is you're making more mitochondria that are actually unhealthy. And when you make more of these unhealthy mitochondria, you get increased superoxide production. And this is a reactive oxygen species, which means it creates more damage to the nerve cells and creates more inflammation. As you increase the mitochondrial density in conjunction with increased reactive oxygen species, we now get aberrant nerve firing and increase what we call nociception. And if you want to think about what nociception is, it's aberrant nerve stimulation. Let's just call it pain. You get numbness, tingling, paresthesia, these abnormal signals that we associate with neuropathy. Because the nerves have a really high fat content, they are more susceptible to the damage of reactive oxygen species. These lipids or these fats become oxidized or damaged. And this hyperglycemic state decreases the antioxidants to deal with the reactive oxygen species. One, we talked about, as you have increased hyperglycemia in the cell, we have upregulation of something called the polyol pathway that depletes something called NADPH, so we lose our antioxidant capacity that way. And as reactive oxygen species go up, there's something called glutathione that gets consumed excessively as well in the process to try and quench this reactive oxygen species. The combination of the increased reactive oxygen species, the upregulation of the polyol pathway, the depletion of our antioxidants causes increased cell damage and death, something we call neuropathy. Okay, so that's episode 5 of the 6 mechanisms that cause peripheral neuropathy.